The video you are about to watch demonstrates an advanced training protocol. Before beginning, please ensure that you have viewed the basic protocols and are familiar with the use and application of Aculife patches.
Hi everyone, Brett Bays here again. I've got another video for you and we're going to show you a couple different things in this video. The first thing I want to remind you though is that I am not a vet, I am not licensed to practice medicine, and LifeWave patches do not cure, treat, or diagnose any medical conditions. We're going to first talk about the respiratory system and how we can stimulate that system to work more efficiently. I want to note that when doing so, we're not addressing any type of respiratory diseases or illnesses that the horse may have. Now, you're going to notice that I have patches obviously attached to the back of my hands. This is simply for illustrative purposes in this video. It allows me to quickly get access to my patches. In real life out there, you guys will have your sleeve full of patches that you'll be working from one at a time. So to locate the lung points on your horse, you're going to be working obviously here in the chest area where I'm at. You're going to be at the top of the pectoral muscles. You're going to feel for small indentations with a little bump to them, and once you locate those, you're going to place your patches white on the right and tan on the left. You're using this protocol to stimulate that respiratory system like I mentioned earlier. The reason for doing that is because you're trying to get your horse to breathe better during performance, have them intake more air and exhale more air. And you're also going to use this when you're in some area of the country that you have a very large range of temperature that you're dealing with. Now we're going to show you the protocols for how to patch for colic. Please note that colic is a serious condition with your horse. You certainly still need to use your veterinarian and get a professional medical opinion and diagnosis on colic and how to treat it. Please do not use the patch placement in lieu of veterinary care. So your first placement that you're going to use is going to be in the low back region on your horse. It is going to be about 4 finger width down from the spine on the bladder meridian that we mentioned in the basic patching protocol videos. You're going to come to that spot. It's almost just forward of the flank, and you're going to apply your white patch on the right hand side, and you're going to take your tan patch and put it again over on the left hand side directly across from your white patch. The second placement for colic will actually be up underneath the horse. You will again use white on the right and tan on the left. This is a gilding, so will actually be almost in the center line on either side of his sheath. These are the 2 patch protocols that we recommend when you're dealing with colic. What I'm going to do right now is show you, if you have a mare, I'm going to show you how to patch your horse accordingly if you're having problems with her in season, out at an event, around other horses and things like that. So we've actually got a mare here that we're going to go ahead and bring in. There. Okay, your first set of patches are actually going to go up in the low back region up here, 4 finger width off the spine. You're going to actually put a white patch on your right hand side and a tan patch on your left hand side. The reason we're using that point is because a lot of your internal organs are all tied to that bladder meridian right there, and a lot of the pain is manifested when they're having cramps up in this area and then down low. Here we're going to show you up underneath where to patch. You're going to have your white patch on the right side, then you're going to take your tan patch and put it up underneath. You're going to be just in front of the nipples under there. Obviously be careful because the horse can have reactions where they're not liking you under there and you can be in harm's way and get kicked. So obviously guys, from what you just saw, you can see that patching a mare that's in season can be very dangerous. We had several people here on the crew helping us, making sure everybody was out of harm's way. Please use extreme caution if you're going to be using this patching protocol. Now I've shown you some specific patching protocols for patching specific issues with your horse. The last one of those issues that I want to address is patching when you have cuts, abrasions, or wounds. Do not patch directly on the cut or abrasion, but actually go ahead and take your vet wrap, put a wrap around that cut, abrasion, or wound, and then place your patches accordingly. If you're working anywhere on the top of the horse, you're going to be white on the right, tan on the left. If you get down into extremities, you're going to be white patch out, tan patch to the inside, right on your vet wrap covering the abrasion, wound, or cut. And that concludes your specific patching protocol video.
LifeWave does not diagnose or treat any medical conditions, and we strongly urge you to contact your normal veterinarian for any questions you may have.
The protocols that we show in these videos are tested and proven to help you manage and identify pain within your horse. They don't mask or block pain in any way.
Horses are inherently dangerous creatures, so we strongly urge you to take care at protecting yourself and your horse while you're patching.
If you have any other questions, please go to lifewave.com, where you can find the numbers for the United States customer service as well as customer service